Hi, this is Jenny Chumbley Hogue with KG Health Insurance and another edition and the Medicare Hat Lady. This week we're going to talk about how many things are coming up in the news because we've got lots of changes coming in 2025. First, I want to start with this. How weird is it that we have 5 days after Memorial Day and May doesn't really end for another week after our long 3-day weekend? But more importantly, grateful for all of those who made the ultimate sacrifice that we honor this Monday on our Memorial Day. It's not just about hot dogs and barbecues. This week, the Medicare Trustees report came out. Once again, on an annual basis, it's the sky is falling report, and your Part B premium is going to be raised significantly. After more than 20 years in the business, my only comment is this: what the Medicare trustees are recommending is not necessarily what's going to happen on January 1st to your Part B premium. And let's never forget, this is an election year. And if history proves true once again, we're not going to see that big of an increase for either your Part B premium or your Part B deductible in 2025. None of the politicians want to announce that right before Election Day. Also in the news, the Medicare final rule came out for 2025, which seems a little early, but one of the big things it contained was a reduction in payments to Medicare Advantage insurance companies. Overall, they got a 2% increase. However, they are going to see a significant reduction in the amount of money Medicare gives them per person based on what's called risk adjustment scoring. If you really want to know about risk adjustment scoring, feel free to shoot me an email at kghealthinsurance.com because I love talking about the wonky stuff, but most people don't care, so I'm not going to dive into it. What I will tell you is this: because the Medicare Advantage insurance companies will be making less money beginning 1/1/2025, expect to see a reduction in what's called supplemental benefits. Dental, vision, hearing. Some of you may even have food cards. Some of you may have gym memberships. Some of you may even get transportation to and from the doctor. As always, you should be reviewing your plan in October, but this year it's going to be more important than ever because not only will we see a reduction in supplemental benefits, we're also going to see a reduction in the number of carriers offered in each zip code. The number one Medicare Advantage plan is Humana nationwide, and they've already announced that they will be pulling out of some markets beginning in January. Also in the 2025 final rules was a change to agent commissions. Medicare Advantage plans will now pay $100 more per person, and Part D drug plans will pay an additional $50 per person. This is not mandated, so some carriers most likely will not be paying insurance agents. However, this brings us to the Medicare Hat Lady's big important rule. When you're going on to Medicare, make sure whoever you're talking to advises you on both Medicare supplements and Medicare Advantage plans. If they're only talking about one or the other, find a new person. The other thing to remember when you're looking at your Medicare plans is this: in 46 out of 50 states, to move to a Medicare Advantage plan after the first 6 months of enrolling in Part B, it does require underwriting. Open enrollment in the fall, you can switch from a Medicare supplement to Medicare Advantage without any problems. You cannot switch from Medicare Advantage to Medicare supplement without going through underwriting. And I hate when people call the Hat Lady in October and they need to switch from Advantage plans to a supplement for whatever reason. And I'm the one who has to tell them, I'm sorry, but in our state or in the state you're living in, you can't switch without underwriting. And it's heartbreaking every single time. So don't forget the golden rule in Medicare. When you're enrolling, make sure the people you're talking to are presenting both options. And this includes retiree plans. Many of the retiree plans nationwide have gone to a model of a Medicare Advantage plans only. If you go on a Medicare Advantage plan when you retire and you want to switch later, it is going to require underwriting. So just because your company is offering you a free plan may not make it the best plan for you. Part of the Inflation Reduction Act Please stop laughing. I know what things cost at the grocery store, but part of the Inflation Reduction Act included significant changes to Medicare Part D prescription coverage. The first change is that finally we have a $2,000 out-of-pocket maximum. The $2,000 out-of-pocket maximum includes the deductible, which this year we are projecting to be at $590. But that hasn't been confirmed, so don't spread it around that the hat lady told you $590, because I'm not promising $590. Another part of the law is that premiums can only go up 6%, which is great and makes a lot of sense. But this is health insurance and the government. So what we are expecting is that plans will no longer be offered, but there will be a new plan in place, went up way more than the 6% on the old plan. So if company ABC's Red Apple plan only costs $10, but they decide next year they want it to cost $20, that's more than 6%. So ABC's Red Apple plan is no longer offered. Now they've got ABC's Yellow Banana plan at $20. That's how they'll get around the 6% rule. Always remember, paying attention to your annual notice of change that comes in September couldn't be more important than it will be this year. Also included, this isn't really a change. However, it is going to be an issue specifically for 2025. We're going to dive into this next week, but if you are over 65 and on your employer plan, we need to talk about how the Part D changes due to the Inflation Reduction Act may make a difference to you in October. Okay, the big one that I really want to dive into this week on changes within the Inflation Reduction Act for Medicare Part D is the prepayment plan. It's going by lots of names. MP3 is the most popular one. And what it is this. Part of the law says that the insurance companies must provide a way for Medicare recipients to pay for their drug costs at the pharmacy, equaling out over 12 months to the insurance companies. So in theory, if you get a prescription that costs $1,000 in January, your insurance company will spread that over 12 months. You will pay approximately $85 to the insurance company, or whatever the exact amount is. And then when you're at the pharmacy, you will pay $0. I think it is a great idea. Everyone will be notified of this with their new ID cards they receive in December from their Part D coverage, whether it's your Medicare Advantage plan that includes your drug coverage or a standalone Part D plan. Great idea. It is going to be fabulous in 2 or 3 years. I am definitely the girl who has been around more than 20 years for both Medicare and health insurance. I survived the 2014 debacle of Obamacare. I have survived every change this industry has seen that involved computers since 1991. KG Health Insurance is recommending to not do the prepayment plan for 2025. I may change my mind for 2026, but there is no way in the short time frame that's been allowed, using health insurance companies' technology and prescription benefit managers and the pharmacy. All 3 of those items have to work together and work correctly for the prepayment plan to work. Great idea in theory. I'm very concerned about how it will work in practice in 2025. So if you just want some advice, the hat lady says no. That's all for this week. Next week, we're going to dive into credible coverage for people turning 65 who are still working and keeping their employer coverage. Have a great week.